Another San Pablo is possible. ODIM, the Organization for the Development of the Indigenous Maya, is dedicated to improving the well-being and future of the Maya people in the Guatemalan highlands. We do this through education and health care. We also facilitate cultural exchange and appreciation between the local people and volunteers from the United States. ODIM is comprised of local staff and healthcare promoters and foreign volunteers who work together to provide services in two villages, San Juan and San Pablo La Laguna, on the shores of Lake Atitlan. In the area of healthcare, we operate a medical and dental clinic in San Juan, where we converted an abandoned Methodist church. In 2012, we recorded over 5,000 patient visits. We have added a diabetes program in both villages and a children's cultural exchange. In San Pablo, we have a nutrition project for families with severely malnourished children, health education, nutrition, and diabetes classes, and a clinic every Friday. In addition, we have a children's scholarship program with after-school tutoring. San Pablo La Laguna is set high above Lake Atitlan with a population of 10,000. There is no tourism, so the economy base is agriculture. The levels of poverty, illiteracy, and malnutrition in San Pablo are among the worst in Guatemala. 97% of the families live in poverty, and 79% in extreme poverty. 72% of the adults are illiterate. In a screening ODIM conducted, 67% of the children under the age of 2 suffer from chronic malnutrition. ODIM currently rents a small space in San Pablo, which not only serves as an auxiliary clinic on Fridays, but also holds tutoring classes for our scholarship children twice a week, together with weekly diabetes and nutrition classes. With our clinic open only one day a week, we fail to meet the needs of our patients in San Pablo, and many cannot afford the cost of travel to our clinic in San Juan, or they are too physically challenged to make the trip. On Fridays, up to 2 hours before we open, patients line up and wait for a chair in the 8 by 12 foot space that acts as reception, waiting, and pharmacy. This environment is cramped, dark, and gloomy, to say the least. As our programs expand, we continue to run into space constraints. At our new diabetes classes, 15 patients crowd in and strain to do their exercises. And at the moment, we use our health promoters' own homes for cooking classes for the nutrition project. The exciting news is that in the spring of 2012, ODIM received a generous gift from the First United Methodist Church of Durango, Colorado, to purchase land to build a new facility, a clinic and education building in San Pablo. This past summer, volunteer teams have cleared and leveled the land, stomped and formed adobe bricks, and have begun digging the foundation. The plans for this building include 2 examination rooms, a pharmacy, an office, meeting areas, a classroom, and a kitchen to be used for the nutrition project. We are working with a specialist in natural building and use locally sourced materials such as stone, bamboo, and adobe. Volunteer teams will continue to be actively involved throughout 2013 and will work alongside and under the supervision of our local construction team. With this new green building, which we plan to complete in 2013, ODIM will be able to offer more clinic services, diabetes and nutrition classes, and tutoring for our scholarship children in a safe, light, and inviting environment. Exciting news! Due to the generous donations we have received, we have the funds to complete this building. We are now seeking your donation to provide the much-needed services to the village. With your gift, another San Pablo is possible.